Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes, with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. In today's episode, Dr. Andy Mayberry returns to share his unique approach to patient care, what he calls dinner and a show. He explains why the best medical care combines clinical excellence with genuine human connection. From the first hello to the final diagnosis, Dr. Mayberry reminds us that rapport isn't just nice to have, it's essential. Stay tuned as we explore how kindness, humor, and authenticity can transform the patient experience.
So maybe let's shift gears a little bit and talk about building rapport with your patients. I think we've kind of touched on that a little bit, and it's definitely come through as you've been talking about, like, you know your patients and you're invested in them. Anything else to say about building rapport? I know when you and I talked previously, you said something about giving patients a dinner and a show. Right. So can you kind of talk to that a little bit?
Patients want dinner and a show. And in Tucson, there's this establishment called the Gaslight Theater where you go there.
I love that place.
You go there and you eat dinner, and they do a little dancey show, singing, dancing up on the stage, and like do melodramas and things like that. And so I call that the dinner and the show. And so the patients come to us for dinner and a show. And the analogy is that the dinner is what provides real lasting benefit, and that is the medical care that we provide. You got to make sure that you're getting the right diagnosis, prescribing the correct medications, and all of that. That's the dinner. You got to make sure that you get it just right. And I'm going to pick on the university here a little bit. The university is all dinner, no show. They don't care about you as a human. They don't care. You just there, you have a disease, they're going to fix your disease, and you're out. And so, but when the patient comes, we need to give them both. We need to give them dinner and the show. It's not adequate to just diagnose their disease and then kick them to the street. And it's not adequate for us to bring them in and be nice to them and give them hugs and pat them on the back and tell them they're wonderful and they look cute with their new haircut or whatever, and then not diagnose them. You got to do both. And we got to make sure that you do both. And I think that we in the allopathic field of medicine sometimes forget that the show is important, because the show is important to the patient, because if you don't give them the show, they're not going to come back. And if they don't come back, you may have the best treatment for whatever condition in the world, but if the patient doesn't come to you, it doesn't do them any good. A while back, I had a man come to me that had a certain medical condition. I won't go into the details. That literally, I've been doing this for 25 years. Sometimes I'm going to joke about it a little bit. Sometimes I can smell what they have from the waiting room. I not literally smell, but I know when this person comes walking in, I'm like, okay, I know what we're dealing with here. And I could just say, okay, here's what you need next, but I don't, because the patient needs to tell you. That's important to them. This guy came in, and literally within, don't want to exaggerate, literally within 30 seconds, I knew exactly what he needed. I knew exactly what he had. I knew exactly what he needed. But he needed to tell me. And so he told me the symptoms, and I sat there, and I played along, and I'm like, oh, really? And I'd ask him, so does it do it then? Does it do it? Oh, yeah. And I let him go through the whole thing, and it was almost like a role play. You know what I mean? Because I knew I could have, I know what you got, boom. And he would, and I hear the people say that all the time. They go, I went to this doctor. He didn't even touch me. He didn't listen to me for 30 seconds. How can he make the diagnosis? So the patient needs to know. And so I sit there and I let him go through his whole story and tell his whole story. And then I said, well, I think you have this, that, and the other thing. And this is how we treat it. And I know that doesn't seem to make sense, but it's because of this, blah, blah, blah. And I explain things. I draw pictures for people a lot, because if I would have told him within the first 30 seconds what he needed, he would have never done it, because he wouldn't have believed me. Let the patient talk. I think it's important when you go into the room, the first thing for a provider to do, and this is just my style, there are different ways to do it, but my style is, I think you need to say something not medical. When you walk in the room and you say, what are you here for? that, in my opinion, in my setting, that's not good. You walk in the room and you say something stupid like, did you get any rain at your house? Or, oh boy, isn't this weather terrible? You know what I mean? And you put the patient at ease. You're a human being, they're a human being. We're two human beings sitting in a room, and it only takes literally 10 seconds just to say, and if there's somebody you know, oh, how's your new dog? Oh, how's your new car? Because they told you that last time. And if you remember that, that's great. But if there's somebody you don't know, you just say something like, this last Monday it was raining. And if somebody was of the right age group, you might be too young to remember the Carpenters. I walk in the room and I say, so do rainy days and Mondays always get you down? And they laugh a little bit, and they're like, oh, I remember the Carpenters. Oh, they were so good, weren't they? Blah, blah. And just a 10-second conversation. Okay, we're both human. I'm human. You're human. Okay, what brings you in today? You know what I mean? I think that that's a good way to build rapport. And not everybody likes my style. I admit that. I am a little bit folksy. Small town guy, grew up there. Do we have time for a couple stories? Yeah. I walked in the room. A lady was there. And I walked in the room. She said, oh, good morning, Andy. She goes, oh, I'm sorry. Good morning, Dr. Mayberry. And I said, and I went to high school with her son. And I said, it's okay. Anybody who knew me in high school can call me Andy. She goes, knew you in high school? I remember when you were born. When I was born, I was 11 pounds, 5 ounces, and 23 inches long. And she's like, I remember you were the biggest baby I had ever seen. And so this is a woman that literally, so these are people that I know, and every doctor has their style. I worked with a doctor once who always wore a necktie, and regardless of the age of the patient that he saw, he called them Mr. or Miss whatever. So he would be seeing a 12-year-old kid, and he would say, well, good morning, Mr. McCollum. What brings you in today? And that was his persona, but that was okay. That's who he was, and that's who his patients came to expect. And I think that's okay. And my persona is different. Not everybody has to be like me. And in a way, that was his show. You know what I mean? Mm-hmm. That was his show. He was the expert. He had the tie, and he had the voice, and he had the good morning, Mr. McCollum. I'm glad to see you come in today. You know, and I think that is a way of developing a relationship with the patient. And my relationship is more of a hey, howdy, hey, how you doing type of thing. I remember I walked in, and I told you this before, but I'll repeat it. I walked in a room, and right when you walk in the room, you never know what's there. You open the door, and it's always exciting. I mean, you don't know what's behind that door, because back in the olden days, there was a chart outside the door, and you would pull the chart out, and you would look at the chart, and you would see, you'd know how old the patient was or whatever. Now with computers, you're just going to your next room, and you don't really know what's in that room until you get in there. And sometimes you can, but if in a busy day, when you're seeing a patient every 15 minutes, you just got finished seeing this patient, you walk out of that room and they're like, okay, you're in room 4. And you walk into room 4 and you don't know what's in room 4. It could be a 5-year-old kid. It could be a 90-year-old man. It could be somebody with a migraine headache with their head, with lights turned out. And so I walk in a room, and just that first split second when you walk in the room, you kind of have to read the room. I walk in the room, and there was an old man sitting in the chair with his arms crossed, kind of like the little boy sitting in the principal's office with this look on his face. And his son was there, and his daughter-in-law were there, and they were all standing there, and everybody was standing there kind of looking at him like he had done something naughty. And I walk in there, and I say, well, good morning. And it was just kind of awkward silence, and then the old man goes, I hate doctors. And I go, oh, good. I hate grumpy old men. Good to meet you. I reached out and I shook his hand, and I put my hand out to shake it right in front of him. And he looks at me and he laughs. He goes, you're all right. and he shook my hand, and we got along just fine. Now, that had the potential of going very, very south. That could have gone really south, really fast. But, you got to kind of read the room, and I think it's important that you be authentic to who you are. Mm-hmm. I don't think the guy with the tie should try to be Andy Mayberry, mm-hmm. and I don't think Andy Mayberry should try to be the guy with the tie. I think you need to be who you are, and you need to be real, mm-hmm. and whatever your real is, and let the patient know that you see that they're real, and build rapport with them, and go in. And again, I think first thing you do is to say hi. I'm glad you're here today. and then say something, oh, that's a nice shirt. Oh, where did you get that purse? That purse is nice. What, those are cool shoes, whatever. That you're establishing that you're a human being. Yeah. That's number one. That's the most important. You're two human beings in a room. And then once you've established that, then you establish the roles. Okay, I'm the doctor. You're the patient. Yeah. We're human beings. I'm the doctor, human being. You're a patient, human being. And then we say, okay, what brings you in? Mm-hmm. And then what can I do for you today? And I think another important factor is let the patient say everything they have to say. Of course, there are limits. Sometimes people go on and on and on and on. Sometimes you have to say, I only have 15 minutes today. How about if we just address the 2 or 3 biggest issues, and then I'll bring you back another day. But one of my favorite things to say is there anything else? Is there anything else? Is there anything else? And so, what are you here for? I'm out of my medicines. Oh, okay. Is there anything else? And then they go on and on. Is there anything else? Oh, yeah, by the way, the other day when I was mowing the lawn, I felt this pressure in my chest. Okay. The previous 5 things that you told me are now no longer important. This is the thing that we're talking about. And that's how you avoid when you're walking out of the door. You spent 15 minutes talking to them about, whatever, different things, blah, 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 blah. They're specialists, they're nephrologists, whatever. And then literally as you're walking out the door, oh, by the way, I've been having this chest pain. Is that anything I need to worry about? You need to get that right at the beginning. And so, is there anything else? I need a refill of my meds. Okay, is there anything else? I think I'm due for a mammogram. Okay, is there anything else? You have it all out. And then once you have it all out, then you can start chipping away. And then I don't feel so bad if then right as you're walking out the day, they say, oh, by the way, there's one other thing. You're like, darn, I'm sorry. Because you've given them a chance to say, is there anything else? Is there anything else? And anyway, so that's the way that I build rapport. And so the show is the personal aspect, and the dinner is the real medical care. Make sure you do both. Don't lean too much into the show. Don't lean too much into the howdy and hey, let's let's hug each other and all that kind of stuff. You can do that, but make sure that you provide the dinner. But don't lean too much into the dinner either. Don't lean just to be clinical. I don't care about you as a human being. I don't think that's therapeutic. The person has to know that you care about them, know that you're listening to them, and know that you're there for them.
Yeah, my mom actually has a really great PCP, and she's been seeing him for a long time, so they know each other. And he's a lot like you. He takes the time to kind of connect with her first before he gets into things. But one time we were there because she was having some lower back pain. And so he said he was going to give her a little steroid injection. And so we're waiting in the exam room, and he's like, I'm just going to go get it. I'll be back. So he comes in, and he has these 2 syringes in his pocket, a small one, of course, that has like the med in it. But he pulls out this gigantic 60 ml syringe. He's like, are you ready for your injection? And my mom's face was just like, and I started laughing because
you knew it was a joke.
I couldn't keep
I hope did he have a spinal needle on it? I hope big old long needle.
He had a needle. It wasn't a spinal needle, just like just a regular, 1.5 inches or whatever. But it was so funny because her face was like, oh my gosh. Yeah. And then I started to laugh, and then he started to laugh, and he's like, no, just kidding. It's just this little, little thing. Sense of humor goes a long way with me.
In my setting, I think it's important for the patients to realize that you're a human being.
Yes.
There may be settings where that's not as important, and maybe probably not good. I don't know. Like if you're working in a prison, or something like that. Maybe you don't want the people to know that you have a wife and kids. You know what I mean? I'm sure there are settings in which you wouldn't be that. But in my setting, I think it's good for people to know that this is, that we're all humans and we're all doing our best.
Yeah, I agree. And, I've been working in healthcare for 30 years, close to 30 years. And I've worked with a lot of doctors and a lot of surgeons, but still when it's me in the exam room as a patient, I still feel nervous. I still, and so I think that connection at the beginning kind of helps disarm me personally, and helps me relax a little bit.
And that's what normal human beings do. I mean, the first thing that you said to me when I walked in the door today was, how was your drive? That's a normal thing that normal human beings do with each other. And so that's a normal thing to ask somebody, how was your drive today? I mean, how was the weather? And that's what, and we forget that we're in an exam room, that we're humans, and that we need to, even though that's the 20th person you've seen today, and you've asked 19 people before that, oh, did you get any rain at your house? Did you get any rain at your house? Did you get any rain at your house? So the person that you're seeing at 5 o'clock, you still walk in the room and say, oh wow, it's been raining a lot. Did you get much rain at your house? They like that. You don't care about the rain. You don't. And I'm hoping that you don't really care so much about the traffic. You cared about me. That you asked that that just means, okay, yes, we're human beings. That's what we do. And I think that's how you build rapport, is to try to make the visit as normal as possible.
In an unnormal, unnatural situation, and doctors are still held in very high esteem. And, I think it's easy to feel, well, the doctor's up here and I'm down here, and, kind of not on level playing field, so to speak. And I think that it's important to reestablish, like, hey, I'm here to care for you, and you're here because you need care, and we broke the ice, and now let's get you feeling better.
Let's dive into this. Yeah, let's get this done. Yeah, let's roll up our sleeves and get to work. Exactly.
Yeah. Yep. Absolutely. Well, we have covered a lot of ground. I think that wraps it up for our discussion on prevention and high-risk patients management.
Awesome.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.